Hey there, and welcome back to Medifit Mosaic. Today, we are diving into a topic that could make a huge difference in your health, recognizing the early symptoms of type 2 diabetes. Type 2 diabetes is often referred to as a silent condition because it develops gradually, sometimes without any clear symptoms at all in the early stages. That is why it is so important to be aware of the signs, even the subtle ones, to catch the condition before it progresses. By being informed, you are taking the first step towards taking control of your health. So let us dive in and explore what you need to look out for. Before we dive into the specific symptoms, let us first talk about why early detection matters so much. Type 2 diabetes doesn't just appear suddenly, it develops slowly over time, often over the course of several years. During this time, your blood sugar levels start to creep up, leading to a condition known as pre-diabetes. When the blood sugar level reach this pre-diabetes stage, your body is already starting to struggle with the regulating glucose. But the changes are often subtle and easy to miss. If pre-diabetes goes untreated, it can progress to full-blown type 2 diabetes, a condition where your body's ability to manage blood sugar becomes significantly impaired. The consequences can be severe. Uncontrolled diabetes can lead to heart disease, nerve damage, kidney failure, and even vision loss. However, if we can catch these symptoms early, there is a huge potential for intervention. By recognizing the signs of type 2 diabetes early, you can start making lifestyle changes that could prevent the condition from worsening. And in some cases, you can even reverse prediabetes. This is why understanding the early warning signs of diabetes is so crucial, because the earlier you detect it, the greater your chances of maintaining a healthy active life. Have you or someone you know been diagnosed with prediabetes or type 2 diabetes? Share your experiences in the comments below. Your story might just help someone else recognizing the importance of early detection. Let us now dive into the common early warning signs of type 2 diabetes. These symptoms often develop gradually, which can make them easy to overlook. But by being aware of the signs, you can catch diabetes early and take actions before the condition progresses. Let us go through the key symptoms one by one. The number one symptom is increased thirst and frequent urination. One of the earliest signs of type 2 diabetes is feeling constantly thirsty, a condition known as polydipsia. It is accompanied by frequent urination known as polyuria. But why does this happen? When your blood sugar levels rise, your kidneys work overtime to filter out the excess glucose. In doing so, your body pulls extra water from your tissues to help flush out the sugar through urine. This leaves you feeling dehydrated and constantly reaching for water to quench your thirst. As you drink more to rehydrate, your body has to eliminate the excess fluids, causing you to urinate frequently, especially at night. If you find yourself waking up multiple times during the night just to go to the bathroom, or if you are constantly thirsty throughout the day, this could be a sign that your blood sugar levels are out of balance. Symptom number two is fatigue and tiredness. Feeling tired all the time, even after a good night's sleep. Fatigue is another common early symptoms of type 2 diabetes. Here is what happens. Normally, your body relies on glucose for energy. But when you have diabetes, your cells can't efficiently use the glucose in your blood because of insulin resistance. This means that glucose stays in your bloodstream instead of getting into your cells to fuel your body. As a result, you are left feeling constantly exhausted and drained of energy. Fatigue is one of those symptoms that can be easy to dismiss. After all, life can make us all feel tired from time to time. But if your fatigue is persistent and doesn't seem to have a clear cause, it might be a sign that your body is struggling to manage blood sugar levels properly. Number third is blurred vision. Another early detection of type 2 diabetes is blurred vision. This happens because high blood sugar levels can cause the lens of your eyes to swell, making it difficult to focus. You may notice that objects, especially up close, start to appear blurry and you might have trouble focusing clearly. If left untreated, prolonged high blood sugar can lead to more serious eye complications like diabetic retinopathy, where the blood vessels in the eyes become damaged. This condition can cause permanent vision loss. So, if you experience any sudden changes in your vision, it is important to get it checked out right away. Symptom number 4 is slow healing sores and frequent infections. People with type 2 diabetes often notice that cuts, scrapes, or bruises take much longer to heal than usual. This is because high blood sugar can impair circulation and weaken your immune system, making it harder for your body to repair damaged tissue. You might also notice that you are more prone to frequent infections, especially in areas like your skin, gums, or the urinary tract. Research shows that individuals with diabetes have higher risk of skin infections and other wounds due to the body's impaired immune responses. If you find that minor injuries are taking an unusually long time to heal, or if you are experiencing recurrent infections, it is definitely worth checking with your doctor. Symptom number 5 is unexplained weight loss or weight gain. Unexplained weight changes can also be a sign of type 2 diabetes. On one hand, unexplained weight loss can happen because your body isn't able to use glucose effectively for energy. Instead, it starts breaking down fat and muscles for fuel, leading to weight loss, even if you haven't changed your diet or exercise routine. On the other hand, unexplained weight gain is also possible. Many people with type 2 diabetes gain weight due to insulin resistance, which leads to increased hunger and overeating. Both of these symptoms, whether unexplained weight loss or weight gain, are important to take seriously and should be discussed with your healthcare provider. Symptom number 6 is increased hunger, also known as polyphagia. Another common early symptom of type 2 diabetes is increased hunger, known as polyphagia. When your body isn't able to use glucose for energy, it sends hunger signal to your brain telling you that you need to eat more even if you have just eaten. This can create a vicious cycle where you continue to eat more, but the glucose from the food doesn't get used properly, leading to even higher blood sugar levels. If you find yourself constantly hungry despite eating regular meals, especially when combined with other symptoms like fatigue or frequent urination, it is a red flag to get checked. Symptom number 7 is tingling, numbness, or pain in the hands and feet. As type 2 diabetes progresses, it can start to affect your nerves, particularly in your hands and feet. This condition is called diabetic neuropathy and it often starts with a tingling, numbness, or burning sensation in the extremities. This is one of the more serious complications of diabetes because nerve damage can occur even in the early stages. If you start to experience persistent tingling or numbness in your hands or feet, it is a sign that high blood sugar levels might be damaging your nerves, and it is essential to seek medical advice right away. Now that we have gone through the most common symptoms, let us talk about how you can recognize these signs in yourself or others. Remember, these symptoms don't always show up all at once. They can develop gradually over time. Here are some key tips to help you identify the signs of type 2 diabetes. The number one is pay attention to patterns. If you notice that you are constantly thirsty, making frequent trips to the bathroom, or feeling fatigued all the time, take note of how long this has been happening. If these symptoms persist for more than a week or two, it is worth talking to a healthcare provider. The same goes for the other symptoms like blurred vision or slow healing wounds. Don't ignore these signs. The number two is monitoring your energy levels. Occasional tiredness is normal, but if you are experiencing extreme fatigue that is affecting your daily life, it could be a sign of something more serious. Keep track of your energy levels and look for any pattern. If you are tired all the time and it is accompanied by other symptoms like frequent infections or vision problem, it is time to get checked. Number third is check for physical changes. Look for physical changes like sudden weight loss, slow healing sores, or frequent infections that don't seem to go away. These symptoms can provide important clues about your health. Regularly checking your feet and other areas for cuts, bruises, or changes that take longer than usual to heal can be a simple but effective way to keep tabs on your health. Number fourth is talk to your loved ones. Sometimes it is easier to notice changes in others before you notice them in yourself. If you have a loved one who seems to be more tired than usual, or if they are experiencing unexplained weight changes or frequent infections, encourage them to visit a healthcare provider. It is always better to be cautious when it comes to your health. There you have it. By recognizing the early symptoms of type 2 diabetes, you can take action to get diagnosed early and start managing the condition before complications arise. Pay attention to your body, stay informed, and don't hesitate to see a healthcare professional if you notice something off. Early detection is the key to maintaining a healthy, active lifestyle. Thank you for joining me today. If you found this video helpful, please give it a thumbs up and share it with your friends and family who might benefit from this information. Take care, and I will see you in the next video.